Dr. Jaffe, what are your top picks for supplements to take for seasonal allergies?
Interesting question. For seasonal allergies, they indicate a need for antioxidants, especially nature's ascorbate, which is better when it's taken with polyphenolics, specifically quercetin dihydrate and soluble OPC, to work synergistically with the ascorbate. Ascorbate is really the maternal antioxidant that sacrifices itself that all other antioxidants can be regenerated and protected. Ascorbate uniquely sets the electrochemical potential of the cell, called the reduction oxidation potential. This has to do with electrochemistry. If you have enough ascorbate, you have a healthy low redox, and you are protected from most pathogens. If you have an ascorbate deficiency, and therefore a high redox, you're at risk of viral, parasitic, bacterial, other pathogenic expressions, which would not occur if the redox was low by having enough ascorbate. So we recommend a C-cleanse once a week to determine how much ascorbate you need each day until you do your next C-cleanse. Then magnesium, the buffering mineral that protects from metabolic acidosis. Cell metabolic acidosis is rampant. 80+% of Americans today have too little magnesium and therefore too much acid inside their cell. You can manage that by checking the morning pH. The first urine pH in the morning tells you how many doses, 2, 3, 4 doses of magnesium, which is 2 capsules, with choline citrate, a teaspoon, in any liquid. And then you need B complex, a super B, such as Lifeguard Super Multi. And now you have protected yourself. You have been able to make use of what you're otherwise taking in without risk. The risks of today, of the 21st century, are many, and they basically come down to anti-nutrients. There are 5 categories of them. We'll talk about that another time, but it's anti-nutrients that use up the essential nutrients, leaving you deficient and at risk. So we have to up our game. We have to take in more ascorbate and polyphenolics, more magnesium and choline citrate, more B complex, enough to keep your urine sunshine yellow. Your urine should not be glass clear. If it is, you're deficient in protective elements that protect the kidneys and the liver. So sunshine yellow, based on Lifeguard, which of course should be taken with food. And then you have the basics. You probably need more omega-3, so I would include EPA, DHA guard. And you might need the suite of digestive aids, including digestive aid, a stomachitic, something that helps the stomach digestion, 3 drops in liquid before each meal. That helps you stay hydrated. And maybe prebiotic fiber, probiotic organisms, and symbiotic recycled glutamine, something very important that we have pioneered, is the recycled glutamine, to energize and repair the enterocytes that line the digestive tract without ever building up glutamate as an excitoneurotoxin. So get the good, avoid the bad, follow nature's alkaline way and nature's pharmacy. I'm Dr. J, bringing the message.